Hi, today we will be discussing Chapter 28 of Harrison's Principles of Internal Medicine. This chapter deals with disorders of the eye. This slide set is part 1 of 3 on red or painful eye disorders in this chapter. In this set of slides, we will first discuss 5 etiologies, namely corneal abrasion, subconjunctival hemorrhage, Pinguecula, Blepharitis, and Dacrocystitis. Corneal abrasions are seen best by placing a drop of fluorescein in the eye and looking with the slit lamp using cobalt blue light. Damage to the corneal epithelium is revealed by yellow fluorescence of the exposed basement membrane underlying the epithelium. It is important to check for foreign bodies and to remove them if present. If the corneal epithelium has been abraded, antibiotic ointment and patch should be applied to the eye. A drop of an intermediate-acting cyclopedic may be given to reduce pain by relaxing the ciliary body. The eye should then be re-examined the next day. Subconjunctival hemorrhage results from rupture of small vessels bridging the potential space between episclera and conjunctiva. Blood dissecting into this space can produce a spectacular red eye, but vision is not affected. And the hemorrhage resolves without treatment. It may be spontaneous or it may be due to blunt trauma, eye rubbing, or vigorous cuffing. Occasionally, it is a clue to an underlying blood disorder. A pinguecula is a small raised conjunctival nodule. In adults, such lesions are extremely common and have little significance unless they become inflamed. They more frequently occur in workers with frequent outdoor exposure. A pterygium resembles a pinguecula, but has crossed the limbus to encroach on the corneal surface. Removal is justified when symptoms of irritation or blurring develop. Blepharitis refers to the inflammation of the eyelids. The most common form occurs in association with acne rosacea or seborrheic dermatitis. The eyelid margins are usually colonized heavily by staphylococci. Upon close inspection, the eyelids appear greasy, ulcerated, and crusted with scaling debris that cling to the lashes. Treatment consists of strict eyelid hygiene using warm compresses and eyelash scrubs with baby shampoo. An external hordeolum or stye is caused by staphylococcal infection of the superficial glands of Zeiss or mole located in the eyelid margins. Topical antibiotics may be applied as treatment. An internal hordeolum occurs after suppurative infection of oil-secreting meibomian glands within the tarsal plate of the eyelid. Topical antibiotics may be applied. Systemic antibiotics may be given for meibomitis or chronic severe blepharitis. A chalazion is a painless chronic granulomatous inflammation of a meibomian gland that produces a peel-like nodule within the eyelid. It can be incised and drained, but injection with glucocorticoids is equally effective. Dacrocystitis is the inflammation of the lacrimal drainage system. It can produce epiphora and ocular injection. Gentle pressure over the lacrimal sac evokes pain and reflux of mucus or pus from the tear puncta. It usually occurs after obstruction of the lacrimal system. It is treated with topical and systemic antibiotics, followed by probing, silicone stent intubation, or surgery to re-establish patency. This ends part 1 of the slide set for red or painful eye disorders. Next set of slides will be part 2 of red or painful eye disorders, where an additional 5 disorders will be discussed.